What are biomarkers? Think of biomarkers as signals in our blood, tissues, or other fluids that give doctors valuable information about our health. Biomarkers may also be referred to by the terms genomic, somatic, or tumor profiling. In breast cancer, biomarkers help doctors detect, understand the aggressiveness, and customize targeted treatment of the cancer. When we talk about breast cancer biomarkers, we usually mention HER2 positive, triple negative, and ER/PR positive. ER and PR are hormone receptors. Estrogen and progesterone are the hormones that bind to them and signal cell division and growth. Normal breast cells have these receptors, and most breast cancers do as well. If the breast cancer is ER or PR positive, there are ways to use medications to reduce the rate of growth of cancer cells. However, if the cancer cells are ER and PR negative, these medications won't work. HER2 is a growth factor receptor. Normally, there are 2 copies of the genes that produce this receptor. In some cancer cells, multiple copies have been created, causing an overexpression of this receptor, which leads to uncontrolled growth of the cancer. If this is positive, targeted chemotherapy can help. This specialized chemotherapy can lock onto the cells that have these receptors. Many cells have them, but the ones with a lot of HER2 will be the cells that are eliminated. There are other important biomarkers too. BRCA mutations, for instance, can be inherited and affect treatment choices. Even if there isn't an inherited mutation, there may be a BRCA or a BRCA-like mutation in the tumor. Mutations that occur only in the tumor can't be passed on to offspring. This makes the tumor cells vulnerable to certain medications, which are less harmful to normal cells. If your breast cancer comes back, it's important to recheck biomarkers. It's also important to look at new biomarkers that weren't checked previously. Here are a few of them. PD-L1 or tumor mutational burden, TMB, are biomarkers that can predict response to immunotherapy. An immunotherapy treatment can be prescribed if these are present. ESR1 mutations change the estrogen receptor so that it resists the hormonal treatment in advanced breast cancer. A targeted medication can help overcome that resistance. A PIK3CA mutation can cause an enzyme to become overactive, leading cells to grow and divide more often. A targeted medication can block this enzyme, stopping this accelerated growth. Recently, some breast cancers previously called HER2 negative are now recognized as HER2 low. These have fewer HER2 receptors, but there's a new treatment that can target these cells. Knowing your biomarker status can help your doctor choose the best treatment. Your best treatment could include an FDA-approved therapy, a clinical trial, or other options. Talk to your doctor about your biomarkers and what they mean for your care. For more information, visit our breast cancer biomarker page on the ShareShare website. When it comes to breast cancer or ovarian cancer, you are not alone. ShareShare is here for you and your loved ones at every stage of the cancer journey.